the number one reason that people get hooked on opioid medications is from a back problem. Did you know that the number one reason someone gets hooked on heroin and ends up on the street is because they were addicted to opioids from their back problem? So listen, if you've ever had crippling back pain, you've been in situations where you can't bend over, you can't put your socks on in the morning, you can't tie your shoes. Every movement sends like lightning bolts up your back your legs. You know what I'm talking about. It's terrifying. It's debilitating, and you literally can't do anything, and it messes you up psychologically, not just physically. And here's the truth, that this type of back pain occurs to almost 8 out of 10 people will have some sort of, debilitating or crippling back pain in their lifetime, which is why I think it's an incredibly, incredibly important topic. So this is the Weaponized Body Podcast. I'm your host, Dr. Ryan Hewitt. As always, I'm bringing you all of the things that I think are really important to know about when it comes to movement, metabolic, and mindset health. And as I mentioned, back pain, and in particular, the dreaded disc herniation conversation is one that I want to have today. And I want to teach people about this topic and why it is not a death sentence. It's not a life sentence to have a back injury, to have a disc bulge, to have a disc herniation, what that shit means in the first place anyway. So I just want to open up with a little perspective about how important this topic is. As I mentioned, roughly 80% of people will experience, debilitating low back pain at some point in their lives. And it's really the number one cause of disability worldwide, if you can wrap your head around that. So most people walking around pain-free have already had some sort of back pain episodes. And, the incredible genius of your body is that your body heals itself. Most back pain is self-resolving. Now, the trouble with just relying on the self-resolving back pain is if you didn't learn a lesson from it in the first place and it was not corrected properly, then you end up with a lifelong vulnerability or problem, which I think a lot of people do. And eventually, people that end up sort of down the whole spiral of the back pain, I guess that type of lifestyle is that they get an MRI at some point and then see that they have disc bulges and arthritic changes and whatnot. But what I've come to learn is that MRI studies on even pain-free people show that up to 76% of them have disc bulges or herniations also. So it means that like most people walking around pain-free have disc bulges. It's not necessarily one of those things that means that you're going to have back pain, which is why there's a saying that now, taking care of people over 18 years and doing thousands of x-rays on people and studying that is that you can never judge how somebody feels based on their images. That goes for x-ray, that goes for MRI. So just because you've been told you have a disc herniation on MRI does not mean that that is even the source of your pain, let alone it's something that's going to be, a lifelong debilitating issue. It's not necessarily, the diagnosis of what's going on with your back. So that's why it's really, really important to make sure that you're visiting somebody when you're trying to get advice about what's going on with your back, who is a highly qualified professional. Unfortunately, and this is going to sound like I'm going to be ripping into medical doctors here, which is not my intention. And I'm going to get into this why. Well, let's get into it now. So, pain is typically not, the main issue with a lot of people that have back pain. It's just that they have a movement disorder that caused the back pain in the first place. The combination of a movement disorder with stress, inflammation, all that type of stuff, that stuff is what really triggers pain, not necessarily what your image looks like on MRI. So, which is why I'm a huge proponent of anybody who has an episode of back pain, if it does not self-resolve, then you should be visiting a conservative practitioner first. What I mean by that is you need to be visiting a movement health professional who practices conservative healthcare, such as physical therapist and/or my preference is a chiropractor. Being a chiropractor myself, of course, this is something that I have been very educated in. I've helped a ton of people with when it comes to back pain. Believe it or not, chiropractic is very well researched. I'm tired of hearing from the scientific community that there is no research that proves that chiropractic is safe and effective. Well, that's bullshit. There is a ton of research over the last 50 years that has been done on chiropractic care, whether it's spinal manipulation, whether it's with chiropractic biophysics, or many of the other techniques out there. There's lots of money and resources that are, well, not comparatively to the medical profession, but there's quite a bit of money and resource that is going into the study of chiropractic, particularly brain-based healthcare, the effect of chiropractic in the nervous system, and improving movement and function. There's a ton of data out there, right? Randomized control trial data. So this isn't, phony, bogus research. So there is a plenty of research, and let alone like all of the anecdotal miracles that have happened in chiropractic offices over the last 100 years. There's just been a ton of people that have benefited from chiropractic care. So listen, when you have back pain, it's getting worse. It's not getting better. Maybe this is not the first time you've had back pain and you're wanting to visit somebody to find out the cause of your issue. My advice is to visit a practitioner who's going to do a thorough assessment. You know who's not going to do a thorough assessment of your back pain? Your medical doctor, okay? A lot of people, they'll go, I'm going to check with my primary care first, or I'm going to go see my primary care first. Well, listen, the problem with going to see your primary care about pain you have is that they are not qualified to assess you, first of all. They may be able to pick up if you're having any, of course, red flags and be able to refer you to the right place. But their standard of, the standard operation is that they'll typically just refer you to physical therapy, which isn't, a bad move, but basically you're just prolonging the inevitable, which is you're going to need to get someone to somebody for a movement assessment. Whereas you could just skip to the front of the line and just go see someone who is more qualified to assess your problem. In my office, for example, we always start with a very comprehensive consultation. We find out about not just what's going on with your pain. We want to know all about that, but also your health history, what you do on a daily basis, what your lifestyle looks like. These are questions you're not going to get from a hospital, from a walk-in clinic, from your primary health care professional. They're not going to ask about how much water do you drink? What is your stress levels like? What's your workout routine like? What's your nutrition like? What's your sleep like? All that type of stuff. Like, this is all really, really important when it comes to tissue and joint health. So listen, in my chiropractic office, we follow up after a consultation with a thorough assessment. We're going to assess your movement. We're going to do functional movement assessment, strength, flexibility, range of motion. We're going to hyperlocate the problem, and we're going to see, is this something that's a joint type of problem that is a motor control type of issue, or are we dealing with more of like a pathology such as a disc herniation? And there are, trust me, there are cases where you're in the wrong place and you need emergency help. It's very few people in 18 years have I seen that I've sent out my door to go see a spinal surgeon or to an emergency room for emergency, pain relief. There have been cases, but if they don't have any red flags, in other words, if you don't have any progressive weakness occurring in muscle atrophy or loss of bowel and bladder control, we're going to assess this thing and try to get you some help conservatively first. Now, speaking about disc herniation specifically, whether it's disc bulge, disc herniation, or a slip disc, right? So it's all referring to similar types of problems. A sequestered disc, sequestered disc, on the other hand, that's when it's like completely, you could just picture a disc that has exploded and squirted into the spinal cord space. That is a, emergency situation. Again, very, very far and few between are these problems. I've seen maybe 2 of them in 18 years, which were both surgical candidates. However, many, 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 and the vast majority of the other ones are not and should be treated conservatively first. And we have a very, very specific assessment that we do to assess our disc patients to make sure that they're candidates for tools that we have to heal disc herniations, such as we have something called a spinal decompression unit, which decompresses the spine, and it's centripetal force that separates very minimally the disc and allows it to, if you picture a sponge, sort of bring in nutrients and expel, inflammatory chemicals. So it assists the process to get people out of pain gradually. We also have something called soft wave, which is a tissue regenerative technology. It's a extracorporeal shock wave, so it's a sound wave. But what it does is it signals the body to send immune factors to the region, such as stem cells, in order to improve blood flow, right, and modulate inflammation and lessen pain. It's a fantastic tool. These are things that are working with your body's natural ability to heal. Also, of course, chiropractic care. We deliver very specific corrective chiropractic adjustments when appropriate. And lastly, is we want the patient participating in this healing process. So pretty much all, or definitely everybody with a disc herniation, is getting some sort of corrective movement and exercise recommendation. They're getting a protocol of physical therapy type movements, such as the McGill Big 3, the very gentle corrective movements they do on a daily basis in order to assist the healing process. Now, fortunately, in my office, we also have some other phenomenal tools to assist the body's ability to heal. I can give people lifestyle types of recommendations that are very, very, very important, right? We're talking about if you want to maximize your body's ability to heal from a disc herniation, we want to make sure you're hydrating properly. We want to tighten up your nutrition and make sure you're not eating any pro-inflammatory foods. We want to make sure that your daily physical habits support your body's ability to heal. So you're not continually rubbing sandpaper on the cut, say by sitting like an asshole on your couch half the day, or, working from a desk that's not supported with proper ergonomics. Those types of really important things. Of course, smart supplementation that's going to help, be the icing on the cake to speed up the healing process. So anybody who has back pain or especially a disc-related problem, it is my strongest recommendation you go see a movement professional who is best equipped to help you with this situation. Those are obviously, really, really important tools. And the last thing I'll say, about other tools that we've been able to apply to some of our patient cases that are far more progressive are things like peptides as well. I've done podcasts on peptides like BPC 157, TB 500. If the conservative care is at a stall, these are some things that we can implement. Yes, they can absolutely help back issues if they're done properly and done, under the guidance of, a skilled professional, preferably somebody who has, a medical director to, oversee the process. So there's just really, really powerful regenerative, really, really powerful tools that help the body heal naturally. Now, if you're able to do this, in many cases, for a lot of people, especially if you do this at a younger age, if you've had back-related issues, you're going to be able to get fixed up really, really well. If you're patient, if you do the work, these are things that you are absolutely correctable. And you can get to a place where you may not even have a vulnerability again. And you get back to the weight room, you get back to training. It's long been known that once you fuck your back up, it's like, oh, you're screwed. You're going to have a vulnerability for the rest of your life. Well, for a lot of people, that is the case, because what they do is they just oh, I'm just going to lay on the couch for a week until my back gets better, and then I'll get back to what I'm doing every single day that's causing the problem in the first place. And they didn't learn shit. And this is the trouble with, I guess, many of our teachings is that like, oh, your body's designed to fail. When you hurt yourself, just go to your primary care and get a steroid or a muscle relaxant or, some sort of pill. And this could be maybe the worst possible fucking plan for a back problem. The vast majority of back problems are from a movement related disorder. Whether it was a movement disorder that was what I consider, I love this analogy or this explanation, is that your back problems come from two different places. They come from either misuse or disuse. I'll tell you my story at the end of this podcast about the misuse that I have been negligent with my back. But let's start with disuse, because this is the vast majority of the population in the United States. Over 70% of people are overweight now in the US and have sedentary jobs. Over 80% of occupations in the United States and Canada is sedentary. So we're talking sitting on your ass or, standing around. Neither of them are really great for your back. When you're stuck on sitting on your butt all day or you're standing all day and you're just, let's say you're maybe averaging 3,000 or 4,000 steps a day, like your body is not designed to be idle. And the misuse, right? So sorry, not misuse, the disuse. So picture this like having your boat sit out on a buoy in the ocean and just don't touch it for a couple of years. Just let it sit there. What do you think will happen? Well, logic would tell you that yes, it would just rust and rot and fill with barnacles. Maybe the engine won't start when you go to try to start it because it's been so long, and maybe there's water or air stuck in the gas line. Your spark plugs need cleaning. Your fuel filters are fucked up. Yeah, you didn't take care of it. What does a boat need in order to maintain? Well, it needs you to use it. It needs you to use it. Same as your body. You need to use your body in order for your joints, your tissues, your discs to stay healthy. Movement is a required nutrient if you didn't know. All right, it's not optional. Using your body every day through dynamic range of motion is an essential nutrient, right? It's not just walking, it's lifting, it's carrying, it's moving constantly. Okay, these are essential nutrients. And when your body doesn't get these essential nutrients, you suffer dis-ease of disuse, right? Of not using it properly. So it's a deficiency. Now, on the other spectrum, there's also disuse, right? Or sorry, I keep screwing this up. Misuse. So not disuse, but misuse. Now, with misuse, meaning you do fucked up things with your back. Okay. Let's say in the gym, you're lifting like an asshole, which is kind of my story. You're lifting too heavy. Your mechanics are flawed. You've fallen off a roof. You played football and smashed your back up a bunch, and you never really, did the work to rehab properly. Just back injuries from misuse, right? If you have a physical job and your mechanics are terrible, your ergonomics suck, you hurt your back in a car accident, those types of things. So essentially there's like micro traumas and macro traumas, right? These all stem from things like bad habits, okay, or bad decisions. It didn't come from bad luck. It didn't come from bad genes. I'm tired of hearing people that back injuries run in your family. It's fucking bullshit. What runs in your family is bad habits. You just copy what your parents and your siblings do. And if it's sitting on the couch and not exercising, well, yeah, you pretty much by design have decided that you're eventually going to have a back problem. And here's what happens when most people have a back problem. They pop pills and they don't change their habits. And then they end up with, in an orthopedics office where they'll either offer injections at first, which cortisone injections in the spine the success rate in the cervical spine is not fantastic, which is in the neck region. The lower back has a better success rate. However, it is never a long-term solution. And this is what a lot of people don't want to hear, is that, yeah, you get an injection in your back, you feel better, but you didn't fix the problem. You didn't fix the movement dysfunction. You didn't fix your posture. You didn't increase your strength. You didn't improve your range of motion, etc. And here's the thing. A lot of people end up with spinal surgery, okay, for disc-related issues, for decompression-related problems. They get microdiscectomies, laminectomies, and even sometimes some fusions. Now, here's the sad truth, is that back pain is it's $100 billion problem per year in the United States alone. And that's just the direct costs, right? So that's spine surgeries, that's all the meds, etc. But here's the deal, is that doesn't even take into consideration all of the lost production, right? All of the work days lost and all of that. So it's more than $100 billion problem. If you didn't know, the number one reason that people get hooked on opioid medications is from a back problem. Did you know that the number one reason someone gets hooked on heroin and ends up on the street is because they were addicted to opioids from their back problem? And here's the problem with the surgery approach, is up to 40% of spinal surgeries fail. There is literally a diagnosis code, which I've seen patients who have had this code before, and they're in my office as a last resort, where I should have been the first portal of entry, is they have something called a diagnosis called failed back syndrome. Right? It's a fancy term that basically means we cut you open, it didn't work, and now you're worse. And in a lot of cases, there's multiple surgeries and they're still worse. And then these people end up on drugs and disability the rest of their life. Meanwhile, the conservative approach, which somehow is not communicated that is your absolute best option, right? Chiropractic, decompression, physical therapy, rehab, it gets people back faster, safer, stronger, without drugs, without anesthesia, without injections, without metal rods, without losing part of their spinal motion forever, right? And here's the thing, is that if I'm able to keep one person off an opioid drug in my career, it's worth it. It's part of the reason I got into chiropractic. So I'll tell you a little bit about my disc herniation story, and hopefully this is inspirational to some people who are really struggling with back problems. So when I started my chiropractic journey, I actually found my first chiropractor because I injured my spine in playing hockey. There was a race for the puck into the corner, and the goalie decided to come out of his crease to play the puck. It was literally like a kind of it wasn't even a regular season game anyway. So, but I ended up getting my feet taken out in front of me from under me, and I slid head first into the boards. Did a little twist at the end so I didn't take the brunt of the force directly on my skull. Thank God I did, because that would have destroyed some of my upper neck bones, which could lead to paralysis. So I took it sort of through the shoulder and through my back, kind of ripped all the joints from my shoulder down to my low back, which some of the neurological dysfunction I have today was from this injury. My left arm is a little bit smaller than my right arm, and I do have a little bit of a weakness pressing on my left side. But the follow from this, it wasn't immediate. I did quickly lose feeling in my legs that came back, and was just like, I had like a spinal concussion for the rest of the day. The next day I woke up, felt horrible. I got all kinds of advices and whatnot. I ended up on some muscle relaxants and pills. And I remember feeling no better. And in fact, I just felt more hopeless and more dopey and more distressed, from that approach. It wasn't till about a month later I met my first chiropractor, Dr. Tapper, and he changed the course of my life, because he not only helped me restore a lot of my health from the standpoint of getting me out of pain and getting me into better alignment. Got me back to the weight room and playing hockey, but he really inspired me to become a chiropractor because it was a healing, an art form that I was unaware of that can help people heal without the use of drugs or surgery. And I fell in love with it. And the more and more I learned about it, the more I've fallen in love with my profession. But this launched my journey to becoming a chiropractor. And but my back was pretty good from my mid-20s all the way up until my early 30s. And I discovered CrossFit by the time I was about 28 years old, and I fell in love with CrossFit as well. And I like to say that, both chiropractic and CrossFit saved my life. I think because otherwise I probably would have become addicted to other things that are probably not so healthy, but I got super addicted to CrossFit. I got very addicted to becoming the best possible physical specimen I could make myself into. So whether that was the strongest, the fittest, the fastest, the most endurance, etc. So I was doing a lot of heavy lifting. Now, my build and my makeup is not that of a power lifter. In fact, I'd be a much more talented marathon runner than power lifter. But in CrossFit, it's more of a well-rounded sport. You got to be good at everything. The first time I hurt my back was during like a every minute on the minute for a 12-minute deadlift. It was my top end set. And at this point, I didn't take the time to really learn how to lift very heavy with proper mechanics and understanding the capacities of like, hey, this is about as heavy as I can lift with good mechanics. Anything above and beyond that is just ego and not worth it. So there was the first time that I felt a big pop in my back, put me on the ground for, a good 10 minutes. And, my day was over. I actually was one of the only times I've ever missed work the next day, adjusting people. I was very physically in pain. And, through chiropractic and, still my early 30s, very healthy. I bounced back fairly quickly within 2, 3, 4 weeks. I was back at it. I did learn something from it, and it was that I needed to pay far more attention to some of my mechanics, especially lifting from the floor. So in the deadlift or hinging, Olympic lifting. And over the years, I just started lifting heavier and heavier and heavier until I got to the point where I was lifting so heavy for my spine that I was starting to injure my back more routinely. And, finally by the years 2016, 2017, I got to a place where I was hurting my back, enough that my competitive days were over. I got to the point where like cleaning upwards of 300 pounds was starting to create such a problem, back squatting over 300, deadlifting over 400. I was blowing up my back routinely. So, I put that to bed, the competitive aspect of CrossFit. I had to learn how to work out again and, started doing more functional bodybuilding. I started getting into Ironman triathlons. I did a Navy SEAL camp. I was really searching for what was next, and I really enjoy physical tests. And by the years 2020, when my daughter was born, the cumulative stress of everything, of my daughter being born, of business, of all the physical abuse that I've thrashed my back with, it came to a head in 2020, 2021. And what did my back in? It was a 3 to 4 day seminar where I was sitting. It wasn't even, a heavy lift that I blew up my back again. It was 4 days of sitting. And after this 4-day seminar, I literally was in the most pain I'd ever been in my life. I couldn't put my socks on in the morning. I couldn't bend down and tie my shoes. I was in agony every time I woke up in the morning and tried to stand up out of bed. I'd have to sit down for 15, 20 minutes in order to get the day going. And man, I was 40 years old. Yeah, it was very, very eye-opening and very shocking. So this is, I was getting adjusted, which did help, but it was not resolving the problem. It was at this time where I explored the possibilities of doing things like stem cell. I didn't mention any of this in the podcast yet, but one thing that I decided to do was a bone marrow concentrate injection in my lumbar spine. So it was my L4-5 disc, which had degenerated significantly. It was bulging. It wasn't causing sciatic pain, but it was just chronic pain anytime I'd bend over. And I did this procedure in 2021 where they took bone marrow out of my pelvis and they spin it, they put their magic stuff in it, and they re-inject it under fluoroscopy or under x-ray into my disc. And I remember Lily was a baby in a crib and I couldn't pick her up out of the crib and put her in. It was horrible. And this went on for another 3 months. And then I woke up one day after 3 months of getting this stem cell injection, and my back didn't hurt for the first time in almost in years, really. But all the severe pain was gone. I could bend down, touch my toes. I could put my socks on. It was incredible. And I just have so much more appreciation of having a healthy back to this point. And, my doctor or my surgeon would be horrified if she knew what I was doing with my back today. But I have learned how to lift correctly. I take care of my back. I take care of my movement. I take care of my health, right? With my nutrition, my hydration, my sleep, my supplementation, my hormone optimization. And I can tell you that 2 weeks ago, I back squatted 315 pounds for 12 reps. I never did that much weight, even 10 years ago. That was pushing it for me, and I felt amazing. My back has never felt better. And it's because of the work that I put in. I was able to do a little bit of regenerative medicine and some corrective care, but without surgery, I've been able to get my back to a place that my back is as strong and as healthy as it's been in over a decade. And I'm 46 years old. So I know that this is possible for people. Low back and disc herniations and, even joint injuries in your back is not something that has to be part of your life forever. You just have to make sure you're visiting somebody who knows how to do a proper assessment, to give you the proper diagnosis and then plan in order for you to heal, which includes not just doing something to you, but also teaching you about the things that you're doing in your life that might be causing you to fuck your back up over and over and over. So corrective things that include lifestyle modification, right? So how you eat, move, and think. And also, get you to a place where you're more pain-free so you can do the work. So that's my story. I wanted to share that today. I appreciate you guys listening. If anybody has any questions, if you're a back pain sufferer, just reach out. Let me see if there's something I could do to help you. I have a vast network of great docs, great chiropractors, really worldwide. So, I can be a resource for you. Happy to help. Just send me a direct message, drryan@weaponizedbody.com. And appreciate you guys. Thanks so much for listening. As always, go ahead and smash that 5-star review, share the podcast, and, let me know what you guys think in your reviews. I appreciate you. I'll see you guys next week.